So in general, you don't want to kind of cut down deep into the corners because sometimes you can stimulate an ingrown toenail to form. And I guess one thing I will say is that an ingrown toenail in and of itself may not be a big deal. If you have a nail that's maybe ingrowing but isn't painful, I always tell people just leave it alone. Don't kind of try to cut it out unless it's painful. Once it becomes tender though, my kind of go-to, and I will say this is not only with patients I've dealt with, but I deal with it myself personally, is I always recommend people kind of trying to use their fingernail to free up that edge of the nail first. So kind of rather than using a tool, using a cutting instrument where you can break the skin and introduce infection, try to free up that edge of the nail first and then take some ibuprofen or some anti-inflammatories, because the pain that you're feeling is usually inflammatory pain. And so if you can reduce that inflammation, if you can free up that edge of the nail, 9 times out of 10, that kind of takes care of the ingrown toenail.